Welcome back to Dirty Medicine's Dirty Ethics series. In this video, we're going to be discussing informed consent. Informed consent is a cornerstone of everything that we do in medicine. The way that you should think about informed consent is it's the process by which medical personnel, especially attendings, explain the medical procedures and the treatment interventions that they are going to be performing on patients. And by explaining it to the patients, they're explaining to them different parts about the treatments, getting the patient's feedback about their understanding, and collaborating with the patient to do shared decision making to determine what course of action or what treatment is best. We're going to begin this video by talking about the 5 components of informed consent. The first part is a description of the procedure. So anytime that you're proposing that some procedure, some test, some treatment be done, you always have to give a description of that test, that procedure, or that treatment. The second component is that you have to explain the risks versus benefits of receiving that procedure, that treatment, that test, etc. So if, for example, you're proposing that somebody get a cholecystectomy, you have to explain the risks versus benefits of getting the cholecystectomy. The third component are the alternatives to getting the test, alternatives to getting the procedure, etc., etc. So everything requires informed consent that we do in the hospital. If you're going to propose that a patient be put on a very, very strong antibiotic that has a lot of known side effects, you have to explain to them the description of the antibiotic, that's criteria 1, the risks versus benefits of going on that antibiotic, the alternatives to going on that antibiotic, so that would include a discussion of other antibiotics that may not work as well in fighting the infection, but maybe have less side effects. So as you can see, informed consent is hugely important, and we're growing this list of the criteria of informed consent. The next part is the risks versus benefits of the alternatives. So criteria number 2 for informed consent was that you discuss the risk versus benefits of the actual procedure, test, etc. 3, you're discussing the alternatives, and 4, you're kind of tying that all together by talking about the risks versus benefits of the alternatives. So going back to my example using antibiotics, if somebody is supposed to be on a really, really strong antibiotic, like one of the carbapenems, but they have hesitations about going on that antibiotic because of the side effects, then maybe what you could do is explain, an alternative antibiotic such as a penicillin, and explain that while this may not work as well, here are the risks versus benefits about going on the alternative antibiotic. And then criteria 5 is just assessing the patient's understanding of issues 1 through 4. So do they understand the description, the risks versus benefits, the alternatives, and then the risks versus benefits of the alternatives. So all of these components are what are packaged into informed consent. And again, informed consent guides everything that we do in medicine. You have to make decisions with patients in a collaborative manner in which informed consent is the overarching guideline that you're using for explaining the information about what you want to do and making sure that the patient agrees. So with that in mind, let's transition to some ethical and legal issues that could come up with regard to informed consent. And the best way to do that is to start with a tricky example. So here's the question. A patient is considering undergoing an elective procedure in which a band will be placed around a portion of the stomach to help create early satiety to aid the patient in losing weight. As part of the informed consent process, which of the following standards are applied by most states in determining whether informed consent was adequate? So this question is really, and I'm going to say this before I read the possible answers, this question is really getting at a legal issue. And unfortunately, on exams, on USMLE and COMLEX, these legal issues come up all the time. So instead of just giving them to you on a slide and making you memorize some crappy information, I figured that a practice question would be the best way to go to hopefully nail it into your brain. So that's our question, right? Patient is going to undergo some procedure. A little band will be placed around a portion of their stomach. It'll make them get full pretty quickly, help them lose weight. So this is bariatric surgery. And as part of the informed consent process, what is the legal standard by which most states determine if the informed consent process was adequate? So just to really make this clear, what the question is asking you and what these answers are describing is what is the standard by which states say, hey, this is the standard you have to meet in order for informed consent to be adequate. So A, what does the patient need to know to make an informed decision? B, What do the statistical majority of patients need to know to make an informed decision? C. What would the average patient need to know to make an informed decision? Or D. What would the typical physician say about this procedure? So which one of those standards is the standard by which most of the states in the United States make sure that informed consent is adequate? The answer here is C. So what would the average patient need to know to make an informed decision? So basically what this is saying is that when you are a physician who's going to be doing informed consent, what you need to consider in your head to make sure that your informed consent procedure is adequate when you go and discuss everything with the patient is, what does the average patient need to know to make an informed decision? And these options have different names, and you should be familiar with them. So A, what does the patient need to know to make an informed decision? That's known as the subjective standard of informed consent. So it's what the patient needs to know, and it's subjective because it's subjective to each patient. C, which is the correct answer, is known as the reasonable patient standard. So most states are using the reasonable patient standard, which is what the average patient would need to know. Not the really intelligent patient or the mentally disturbed patient, but the average patient. That's called the reasonable patient standard, and you should definitely be familiar with that term. D, what would a typical physician say about this procedure? That's known as the reasonable physician standard, and it has been used in some instances because it's what a reasonable physician would explain to a patient. But at the end of the day, informed consent is about the patient, not the physician, and that's why most states believe that informed consent is most adequate when it's the reasonable patient standard. So that's very, very high yield. Please know that. Let's talk about some of the exceptions to informed consent, right? In what situations do you not need to get the informed consent of a patient to do some type of test, procedure, lab, surgery, etc.? So here are the exceptions. One, the patient is incapacitated. So if the patient's incapacitated, they obviously can't give you informed consent. And if they're incapacitated and need some kind of life-threatening emergency procedure, test, whatever, which sort of transitions us into number 2, which is a life-threatening emergency with no time to get the informed consent, then it is okay to proceed. Number 3, they have no capacity or competency. So obviously if the patient doesn't have capacity, or if the patient has been legally and globally stripped of their competency, then you're not going to get informed consent from them. You're going to seek a surrogate decision maker. And we'll talk more about that in a surrogate decision maker video. Number 4 is you're dealing with a non-emancipated minor. So we're going to talk about what it means to be an emancipated minor in a future video. But if you're a non-emancipated minor, then the informed consent does not come from you as the child or adolescent. It comes from your parent or legal guardian. Let's wrap up by talking about a couple other quick high yields, and we'll do one more practice question. Basically, with the informed consent process, you want to make this a shared decision-making, collaborative kind of environment. If you get a question about what kind of mood or environment you want to set, look for the words shared decision-making or collaboration. I know it sounds ridiculous, but it has shown up. The surrogate decision maker is the person who's going to make the decision and get the informed consent if the patient does not have capacity or competency. And we're going to talk about surrogate decision makers in a future video, so don't worry about that term just yet. Let's conclude this video by finishing with one more pretty tricky practice question as it relates to informed consent. Here's the example. A 22-year-old female who is currently 28 weeks pregnant screens positive for high blood pressure. She subsequently develops full-blown eclampsia and seizes on multiple occasions. You are very concerned for the mother and the fetus and immediately recommend IV magnesium and diazepam. The mother refuses. She acknowledges that this puts the fetus at immediate risk of death. Which of the following is the correct immediate course of action in this scenario? So this is an informed consent issue, right? Because you're giving informed consent about, you're trying to get informed consent about giving these medications, and the mother is refusing. But it's not, it's tricky because it's not just the mom here who's at risk of death, it's also the fetus. So which of the following is the correct immediate course of action? A, allow mom to refuse the treatment if she has the capacity to do so. B, allow mom to refuse the treatment if she signs an against medical advice form. C, do not allow mom to refuse the treatment. Explain that you are bound by law to protect the unborn fetus. D, do not allow mom to refuse treatment. Attempt to understand why she is refusing treatment. So pause this video if you want to think about this, and I know that it's a tricky question, but if you're ready, here's the answer. So the answer to this question is A. Allow mom to refuse treatment if she has the capacity to do so. This is really important, and I want you guys to remember this. Anything that a mother who's carrying a baby or a fetus, anything that she wants, goes. It doesn't matter if it puts the fetus at risk of death, especially if she has the capacity to do so. So in this case, assuming that mom has capacity, she is absolutely allowed to refuse treatment. So in your informed consent process, even if she is refusing to give informed consent and it's immediately putting the fetus at risk of death, she still has the right to do that if she has capacity. Patients will never sign in against medical advice form when it comes to decision making, so choice B is wrong. Choice C is not correct. You are not bound by law to protect the fetus. You are bound by law to protect mom. And choice D, while technically the second part of the question sounds pretty good, you do want to attempt to understand why she's refusing treatment, you still have to allow her to actually refuse the treatment. So that's why D is incorrect. Now that's the end of informed consent, and there were a lot of topics in this video that are going to be discussed in other videos, like emancipated minors, surrogate decision makers, etc., etc. So see those videos in the rest of the Dirty Ethics series for more clarification.